All right, now we're going to talk about Chapter 10, the Urinary System. We're on page 94 of the Medical Assistant Guide. Urinary System. Again, I always say, underline and start all of and the above, and make sure that you know these little paragraphs that start those chapters. The urinary system is defined as a group of organs that are responsible for filtering out excess fluid and substances from the bloodstream. Underline that. Its purpose is to filter out excess fluid and substances from the bloodstream. Underline what urine is. It's a liquid that is produced by the kidneys, collected in the bladder, and discharged through the urethra. So where is it produced?
In the kidneys.
And we collect it,
In the bladder.
and then we discharge it through the urethra. Urine is also used to withdraw excess vitamins, minerals, and blood cells from the body. So everything's going out of there that we don't need, and your kidneys are working hard trying to make all that happen. And your kidneys break down, that's why everything starts going wrong, because you're not cleaning the toxins or the things your body does not want, and its body can't clean it out properly. Organs of the urinary system are your kidneys, which are your main structures, the bladder, ureters, and the urethra. Although the urinary system works with other bodily systems to maintain internal stability. So we need our urinary system along with everything else. Kidneys. How many we got? Two kidneys. They are located, and I want y'all to underline this. The kidneys' long axis are even with the body, but each kidney's upper end is slightly tilted toward the backbone. It's slightly tilted toward the backbone, the upper part. A lot of times when you have kidney problems, kidney infection, you feel your back. People don't get it, but that's could be urinary, it could be your bladder or kidney, but you feel it all in your back. And then that's where people think it should be in the front of them, but they'll feel it in the back. The helix. Know what a helix is? We also had a helix in the lungs. Same thing. It's where everything goes into the kidneys. It's just like and I call it, looks like a tree trunk. And then everything comes from there. So the tree trunk goes into the kidney bean, and that is the helix. That spot there where all your stuff goes into the kidneys, that's what is a helix. Same with your lungs. Same kind of idea there. The helix, located in the midsection of the medial concave border, it's just the curvature, is the entry and exit port of your veins, arteries, nerves, lymphatic vessels, and upper ends of the ureters. All that's going on right there. Same principle as your lungs. The helix is that important. It is the root of it. Okay? Shaped like a bean. It measures 4 to 5 inches, and there's different parts of it. We're not going to worry about all that. We do need to know the principle of those. As the cortex is the outer portion of the kidney. The center, they call it the medulla. A lot of nephrons is in there. I think we'll talk a little bit about your nephrons, but they're so important things in your urinary system. They maintain water salt balance. The pelvis is the upper end of the ureters. And the renal artery are the arteries that supply your kidney. They come from the abdominal aorta and supply that kidney. We got to have them. 96, it's actually going to break down each of the parts of your urinary system. So your ureters, we got 2 of them. Underline it, channels urine from the kidneys to the bladder. So coming from the kidneys to the bladder, you got ureters. At times, the ureters can become infected, causing urinary tract infections. Underline that. That's that last sentence on that paragraph. Urinary bladder, underline that first sentence, is the organ that temporarily stores urine from the kidneys. It can hold about 15 ounces of urine. Here's a good place to remember how many ounces make up, how many milliliters is in 1 ounce? You gotta know this. CNA, if y'all are CNAs, if y'all don't know this, we are fighting.
Oh, we took the test. We had to take a test on
How many milliliters is in 1 ounce?
8.
No,
Yeah.
16.
no,
Yeah, 30 ounce.
30.
Yeah, 30.
Y'all got to know that. How are y'all measuring y'all's liquids? You go to a hospital, you're gonna have to do input and output. So you've got to, each day you should be recording. Where do y'all work at? I'm sorry. Each day you should be recording. Yes. And you have to estimate, guesstimate or something. How are you guesstimating? Yes, yes. In ounces or milliliters? How about if they just drunk a carton of milk?
We have to convert it over, but it's easy.
Yes. 8 times 30.
No, we don't do that. I think it.
240.
Yeah.
That's how I learned. That carton of milk is 240 milliliters. Now I get that. So I grew up with a carton of milk, and so I kind of estimate. Some won't vary more exact, and you try to encourage your patient to please drink that so you can have an exact number because you know exactly what was in there. So you won't have to pour that out and say, well, they left out a couple of milliliters. But eyes and nose are very important in the hospital. People have kidney diseases especially. You've got to know because they're going to be on fluid restriction. They're going to tell you they can only have 15 milliliters a day, or 1,500 milliliters a day is what they're going to tell you. Then you're steady in there throwing them water, or you're steady, you don't know what that is, so you don't give them nothing. Oh no, you're on fluid restriction. No, they can still have fluid, but up to a certain amount, so you need to know what that is so you can do your patients right. Either, and that's how people are, either they're going to be like, oh, no, you're on fluid restriction. I might give you an ice cube or something. But they can drain. It's just a limited amount. You got to know what your 1,500 cc's look like. Cc's and mLs are the same. Like this one right here, this is 591. I would say 20 times 30 is 600. Estimate that's 600. So they can still drain. It's just how much can they drain. So, and a lot of them are on 1,500. You got to know that. You don't want to starve your patient, make them thirsty as heck, but you don't want to give them too much either. So know that. 1 ounce equals 30 milliliters. Write that down somewhere. I don't know if this is going to be on this test or whatever, but that's something that should be your basic understanding. 1 milliliters equals 30 cc's. Sorry, y'all got it. 1 ounce is 30 milliliters. Get that, stick it in your head. A cup is 8 ounces. So they say they drank a cup of whatever, we know 8 ounces. So 8 ounces is how many milliliters? 240. 8 times 30. Okay, get that in your head. That's going to be something that you're just expected to know. And put that in there. In there. Urinary bladder is what we were talking about. It can hold up to 15 ounces of urine. So is that a lot of urine?
Yeah.
What's 15 times 30? A lot of urine. So that urinary bladder is awesome. It's awesome. It can hold this urine. Once filled with urine, so-called stretch receptors send impulses to the spinal cord, which sends back a reflex nerve to the sphincter, a muscular valve at the bladder neck. There is a sphincter there at the end of your bladder that says, okay, I'm full, we should release. And it will go down there. There's also one at another sphincter then you control this one, the one when you go sit down on the toilet and actually use a restroom. There's a sphincter there. And there's actually a sphincter at the bladder. Urethra, that is the last part of the urinary system, as it is part that removes urine from the body. It's about 1.5 inches for the female and 6 to 8 for the male. And if you ever had to put a catheter in, you'll definitely know the difference.
Yeah.
Because you're going to be just keep on pushing. As a CMA, you will not be putting in catheters unless they strictly train you. You're going to have some kind of notification, written signatures that you are able to do that and that you have been trained. It could be a separate certification or something like that, but your job can certify you, but not so often. They don't even too much let the LPNs. They're going to, because it's got to be a sterile procedure. Because you get urinary tract infections so easily. Also, that's another reason why, because 1.5 inches long for the female, bacteria just had that little 1.5, probably about that much, to get there and cause an infection. For a man, it's got to travel. By the time a man uses urinates again, you know, they done swipe the bacteria out of there, even if it was working up trying to get bacteria. That's why they don't get as much urinary tract infections as females. Urinary or urethral sphincter, that is controlled by muscles and nerves. A lot of times that can be affected if somebody has a stroke and they become incontinent. That causes them to be incontinent. This sphincter here stops working as well, but we actually can control that sphincter. But it also works with muscle and reflex. So know that somebody can have a stroke and it affects their urinary tract system as well. So you have that internal sphincter, which is located at the neck of the bladder. And then your external is what we use to let it on out, or is right there. So we use those. Nephrons, they're very important, and lots of things take place, page 97. Nephrons are structural and functional components of the kidneys. Underline, they are responsible for production of urine in the process of waste removal and excess substances from the blood. They're responsible for the production of urine in the process of waste removal and excess substances from the blood. So it's getting all the bad stuff that we don't need out. That's number one. Nephrons remove waste from the body. That's one thing it does. It manages blood pressure and volume. That's another thing it does, along with electrolytes and metabolites and all that good stuff. Also manages pH of blood. So nephrons are very, 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 very important. They're very, very, very small in the kidneys, and when they stop working, a lot of things don't happen. And a lot of people get on dialysis because we say the kidney's not working, but we break it on down, their nephrons are messed up. Something's happening in their nephrons. The functions of the nephrons are essential to life and are regulated by the endocrine system by hormones such as aldosterone, antidiuretic, and parathyroid. We already know aldosterone. And how do we know that? From our blood pressure medications. I tell y'all to get on them, because you're going to have to differentiate which one is affected by what. Antidiuretic hormone, parathyroid. All that will affect your blood pressures. Come on down and underline the renal corpuscle. It filters out large solutes. So what filters out large solutes? The renal corpuscles. And solutes are just substances. It's just something that's big. Something big that we don't need. That's solute. Glomerulus. What's most important that you're going to see and recognize, hopefully, it is a capillary tuft located where? Within a Bowman's capsule. Just like any protective anything, your glomerulus is protected in the Bowman's capsule. So what is in the Bowman's capsule? The glomerulus. The whole thing that we're talking about is in the Bowman's capsule. So where's the glomerulus?
Bowman's capsule.
In the Bowman's capsule, yes. All it is it surrounds the your glomerulus there. And it initiates the formation of urine. And that's what all this is doing. We're filtering blood, filtering out urine. We're not going so deep as to know exactly where, because, nursing school, you're going to know exactly where in the tubes. They've got tubes that come from the nephrons and where some water comes out, where salt comes out, and this loop of Henle. If y'all have ever heard of that one, while you was in anatomy, human anatomy, 11th, 12th grade, nursing school. But all that, they want to know where that salt comes out, where the water is reabsorbed. All of that is that real breakdown. We're not going that deep. We know about the kidneys and we know about our nephrons, and your glomerulus. All that same functions though, filtering waste, forming urine. Okay, you got your afferent and efferent arterioles. Just underline this for me. That last of that sentence, or that little paragraph there. Afferent arterioles play an important part in regulation of blood pressure. And all that is where they're coming from in those where it's the glomerulus. Efferent arterioles are an important part of maintaining glomerular filtration rate and blood pressure. So they're helping blood pressure all the while, because if they're not removing stuff, blood pressure is affected. So don't think long and hard about that. I want y'all to focus on that glomerulus. And this one, the Bowman's capsule. It is a cup-like sac that surrounds the glomerulus. So what surrounds the glomerulus? And what's inside the Bowman's capsule? There you go. Just get that in your head and you're going to be fine. We're digging a little deeper than we might have known before, but we're just going right now with the structures. Where is that Bowman's capsule? Where is the glomerulus? What is the Bowman's capsule? Surrounds the glomerulus. Okay. It's made of visceral. In other words, it's controlled on its own. Y'all know we don't tell the urine what to do. And all of that is part of your autonomic system. All of that's happening together. And that's all we want to go digging in there. But I do want you to underline that last sentence on page, it continues to page 98, where it's telling you what's going on in the Bowman's capsule. The passage of ions, that's your pluses and your minuses. I mean, they're going deep. Water, small molecules from the bloodstream into the Bowman space. Just know that is happening. That's what's going on. And it's just the space where things are happening. Just like our capillaries, where everything's happening there. Right there is where all that's happening. Your big stuff actually happens, your water and salt. Those are big things happening. These are your smaller stuff. Proximal convoluted tubule, don't go digging on that. I just want you to know that it helps. Come on down. It's responsible for regulating the pH. And just say regulate the pH. Don't even think harder. Regulates pH. And as far as when you pull blood, you will know creatinine level. When somebody's creatinine level is messed up, if it's too low, that's messed up too. But if it's too high, guess what? Their kidneys are not working. Creatinine is not what you want floating around anybody. That is how we can tell also that your kidneys are not working correctly. Your creatinine level, because this is where what's happening here is where the creatinine is actually removed from your system. If it's not removed, it continues in your system, messes you up, and we can tell that through blood tests. So we look at the creatinine level. But don't go digging. Distal convoluted tubule. This is where a lot of your blood pressure meds, again, always talking about their blood pressure meds, because they are being affected. That urine is all about blood pressure. If we don't remove the water, then it makes our blood pressure higher. So all of this is part of blood pressure. So the cells that line the DCT, which is your distal convoluted tubule, this is all I want you to know. It's 1, 2, 3. If the parathyroid hormone is present, it reabsorbs more water. And this is where medications If they can give a medication that causes more parathyroid hormone to be excreted and can help your blood pressure. Now, if aldosterone is present, it reabsorbs more sodium. And you can remember the end, but the basic is that first part. And then your atrial natriuretic peptide, y'all heard this, all in them blood pressure pills. It messes with actually your heart arteries, and it's excretion of more sodium. All of that's helping blood pressure, blood pressure, blood pressure. Just get those in your head. And that is how things are being filtered in those kidneys. Page 99, you can breathe a little bit. Y'all gonna have to get those little new parts of your urine in there though. Functions of the urinary system. Major function. Number 1, eliminating waste products of metabolism and other materials called excretion. Underline that. What is the function of the urinary system? It eliminates waste products of metabolism and other materials called excretion. So urinary system process is the process of eliminating waste products of what? Metabolism and other materials called. Eliminating waste is also called excretion. But what are they eliminating waste products of? Metabolism. Metabolism happens, it can't help but happen. That is called metabolism. And so once all that happens, it makes things that our body does not need, so we need to excrete them. And that's all that they're trying to say there. The urinary system also regulates concentration of electrolytes. Underline that. Potassium and sodium is electrolyte as also. So we know that. And helps regulate normal pH. I don't want you to go digging in this next part because they don't ask a lot of questions from this part. But it is, you'll have to know it if you go any further. They will ask you those type things. That's how we know what kind of fluid to give you. Instead of the regular fluids people get, it depends on your pH, it depends on your osmolarity, what fluid you get when you are dehydrated, what fluid you get when you just had surgery, what fluid do you get when you, all that, it tells you, and you'll have different types of fluids. And I'm not going to go digging in that. But just know the basics. Number 1, it regulates ionic composition. Underline that. Plasma osmolarity. What is plasma?
The white stuff
In your blood.
yellow stuff.
Not quite right. It's the liquid part of your blood. It removes metabolic waste. And come on down, secretes hormones. Those are your 6. Oh, there's some more over here. 6 important roles of the kidneys. Number 5, come on over, is filtration and reabsorption. But within that, page 100, we're going to form some urine. How are we going to form urine? Formation of urine happens in 3 steps. Filtration, reabsorption, secretion. And I always keep telling y'all, don't think too hard. Filtrate just means filter. It's filtering what we need. Then we're going to keep what we want, reabsorb, and then it's going to secrete the stuff on out. So filtrate, we're sorting it out. We're filtrating it. The first step in urine formation is the process that occurs continually in the renal corpuscles, and we're filtering it. Filtering out waste products, such as urea. Underline that last sentence. Urea is produced by the body to remove ammonia, which is formed in the liver from amino acids. So when your urine's real strong, that actually means that your kidneys are working, getting the ammonia out of you, which is fine. Let it work. A lot of times if you smell it as much, that means you have not drunk water with it. But it means that your system's working right. But you need to drink some water so it won't be so strong. Underline that too. Urea is the most abundant waste product that has to be excreted by the kidneys. And that's kind of where we get the word urine from. Then we got to reabsorb what we need. And it tells you where it's reabsorbed at. We're not going digging, but we do need to know what three main substances are reabsorbed. We're going to reabsorb water, which is 1. Glucose, which is 2. Sodium ions, which is 3. We need all that. Sometimes we don't need it. It will be excreted if it's too much in there. But most of the time we are reabsorbing those things that we need and excreting what we don't. Secretion. The third step in formation of urine is secretion. It's the process by which substances move from the blood and the capillaries into the distal and collecting tubules. They got a lot of names, but collecting tubules, all that means is they're collecting it up, kind of like your bladder. It's kind of getting there. A lot of things happen there, but they're collecting it there in your tubules. A lot of things happen at that point, as well as potassium, hydrogen, ammonia, drugs will all be secreted out into your urine. And that last sentence. Urine is the collection of substances that have not been reabsorbed during glomerular filtration or tubular reabsorption. It's just telling you glomerulus filtrates, tubes reabsorb. Everything else is going to be secreted. And where does it go? To your bladder. We done did it. We done checked it out. We kept what we want, and the rest of trash goes onto your urine. Page 102. And here it goes, going back to those blood pressure pills, all about your enzymes and hormones. Some of those blood pressure pills will affect that. Your water-salt balance. Kidneys are responsible for maintaining and underlying water-salt balance in the blood. They're just reiterating what was learned earlier. The balance can be changed by simple factors such as dehydration, ingesting water, blood loss, salt indigestion. So if you're eating too much or drinking not enough, all of that affects your water-salt balance. So your body's always thinking. So, what causes reabsorption of water? It's called the antidiuretic hormone. Just look at the word, antidiuretic. You know what a diuretic means? It means to push the water out. If it's antidiuretic, we're going to hold on to that. Just underline that. And we all need that. The antidiuretic hormone is responsible for the direct control of water excretion in the kidneys. Underline that. And they call that ADH. Reabsorption of salt. Of course, we know the kidneys regulate salt balance. Aldosterone. Underline that. And just get it in your head that aldosterone promotes the excretion of potassium and reabsorption of sodium. So, aldosterone reabsorbs sodium. So, if you're reabsorbing sodium, what are you probably also reabsorbing with it? Water. You actually reabsorb water. The antidiuretic helps you hold on to water. Reabsorption of salt, actually, the salt comes with it. I mean, water comes with it, but if you're holding on to salt, that's water as well. And that's where you get your blood volume, how much blood you got circulating in your system. And we need that aldosterone. So your atrial, natriuretic hormone. What is atrial? Y'all know what an atrium is, right? Where's the atrium? In your heart. So, if we got an atrial natriuretic hormone, underline, it's released by the atria of the heart, when the cardiac cells are stretched due to higher blood pressure. So your heart says, hey, I got too much fluid going on here, and it talks to the kidneys. It says, hey, you need to release some of this. And again, goes back to them blood pressure pills. What is it affecting? The walls, the arteries, or your heart? So your atrial natriuretic hormone releases in your atria, which causes, which talking to your kidneys to tell it to do what it needs to do. And page 103. This is one of your diseases. I don't know, it's a little backwards on this, but we'll get through it. Your hypernatremia is exactly what it says. Hyper, Na, always means salt in your blood. Emia is always in the blood. So you got too much salt in your blood. And you can underline that first sentence. It's an increase in plasma sodium levels. Don't worry about the rest of it. We just need to know hypernatremia. Diuretics, we know what they are. They're water pills that actually elevates the rate of urine excretion. Underline that. Don't go digging in these chapters. In these here. These condition causes sodium and water loss through urine. So we know that diuretic. This all of that. Flip on over to kidney infection. Another name for kidney infection, that's page 104. It's pyelonephritis. Anything pyelogram, all of that means kidney something. Kidney something. And that's part of the kidney. They call it pyelo something. It's the kidney. Pyelonephritis. It's a urinary tract infection. Underline that. Come on down to where it says it can cause permanent damage to your kidneys. It's pretty bad. One of my friends' children got it, and they were so worried about it. A lot of times something's happened. You done had some kind of surgery, something that gave them an infection there. Bladder infections, long-term use of catheters, enlarged prostate, kidney stones, anything that would make urine sit around can cause a urinary tract infection. That can cause pyelonephritis, which is really that your infection got so bad it's in your kidneys. It's not just in your bladder or your ureters. It's done went into your kidneys. And you can get sepsis real hard and easy. And how about your elderly? Get it real quick. Next thing you know, the elderly get confused. Come on down. Kidney disease. Just underline, kidney disease is the result of damage to the nephrons. The nephrons is kind of like our capillaries of the blood vessels. Everything's happening. The important stuff is happening there in your nephrons. Also underline, a person might be at risk for kidney disease if conditions like high blood pressure, diabetes, heart disease, or kidney disease in the family history are prominent. Just underline knowing that is a bad mixture. And my friend's got all of it. Her sister's passed, was on dialysis and passed. Her brother passed, mother passed, and she's working on congestive heart failure being caused by high blood pressure and stuff like that. But it's family, her whole family. Just know that diabetes can affect it as well. Those are little bitty things happening in them. Sugar molecules are too big for everything to be passing through, so it messes up your kidneys bad. Blood pressure messes up your kidneys bad. Just like you're about to bust something and it continually, you damage things. Flip on over to glomerular disease. Just underline that first part. It damages the glomerulus. That's it. Underline that. Know that albumin does a lot in your regulation of your urinary system as well. We would do an albumin test to see. It actually tells how healthy a person is. If their albumin is low, if they look emaciated, that means they look like they have an AIDS, they look drained, they look like they've lost a lot of weight. We'll check their albumin levels, but albumin does a lot of stuff as well. But a glomerular disease, I want you to come on down where it says symptoms. Include swelling in their hands, face, feet, ankles, foamy urine. Underline that, foamy urine. If you got foamy urine, something might be going on with your glomerulus. And that's headed toward kidney disease, headed toward dialysis. You might have blood in your urine, anything like that. But we do not want none of that to happen. When kidneys fail or can't work efficiently, dialysis or kidney transplant. That's it. And we don't want that to happen. Kidney stones. Underline is most common, one of the most common disease of the urinary tract. And that next sentence, they're small, hard substances developed from mineral salts and other waste products in your urine. So it's just stones. It's the stuff that gets too big to pass through your ureters or your urethra to the outside. So they call them kidney stones. The causes for it is urinary tract infections can cause it, hyperparathyroid, cystic kidney disease, all kind of stuff can cause it. Just know what they are. And underline this one. Most common symptom is sudden pain, but other symptoms include painful urinating, blood in the urine, fever, chills, and or nausea, vomiting. But the most common is sudden pain, and it's terrible. It's like somebody is taking a knife and dragging it through your body. I had one pass in my lifetime, and it hurt. And I was about to call into work, but once it was over, I was like, I felt like a whole new woman because that pain was gone, and I really felt how good I really felt before the kidney stone. Because the kidney stone, I was bent over, couldn't walk, couldn't talk because it was that painful. And I was going to go to the ER. I always wait too long. By the time I was ready to call in, I started feeling better. I was like, oh. But I called in anyway. I can't take it. I felt like I went through some kind of ordeal, but I felt so much better. You don't realize how good you feel until somebody drags a knife down your system. And that's what it felt like. It's terrible and painful, and that's what I want you to get. Kidney stones are painful, more as like urinary tract infection. You're using the restroom. It's painful when you urinate. Kidney stones, you're not doing anything. It's just passing. Then I want you to know the difference when they ask those type questions. We'll get there though. How are we gonna fix a kidney stone? That last sentence, lithotripsy. All that is they go in there or not. Sometimes they'll go in there and blow it up. Now they've got a little laser that can go through your skin and they'll blow it up. And they're just exactly what it looks like too. They like blowing up little boulders. And all that's happened is you've ate something that didn't really gather together and didn't break down like it should. And it held together and it didn't break down. That's a kidney stone. Urinary retention is exactly what it means. It's unable to empty the bladder properly. And you're holding it in, called urinary retention. And it could be a terrible feeling. Some people just can't urinate. We'll go in there and straight cast people because of urinary retention. Some people straight cast themselves, you wouldn't even know it. They've got straight casts in their bag because for some reason their sphincter is not working. Something's not working. And they have to do a straight cast. And there's a lot of people, actually, you wouldn't believe it, that are buying their catheters and doing it themselves. So they, otherwise they'll have to be somewhere, somebody to take care of them, so they take care of themselves. Underline, we already discussed urinary tract retention might require catheterization. Underline that. If you're retaining your urine, we may have to catheterize you. When using catheters, it's important to sterilize them. Underline that. And they choose to add this as well to your learning. Right here, we need to know what sterilization is and what an autoclave is. Sterilize them. Sterilization is the process of complete destruction of all living microorganisms. Underline that. They just kind of stuck that in there. We're learning right stuff, but There's what sterilization is. And know what an autoclave is. It's sometimes used to sterilize medical equipment and supplies in order to prevent infections. And an autoclave is wonderful. Actually, it's going to kill everything, even up down to your worst ones, which are your spores. Then we got urinary incontinence. It is the accidental leakage of urine caused by problems with the muscles and nerves that help hold or release urine. That's where a lot of people become urinary incontinent after surgery. Sometimes it's damage to the muscles itself. Sometimes it's overworkage of your muscles. I don't mean overworkage, but you haven't exercised them. Oh, excuse me. Or damage to the nerves, and that's where the stroke comes in. If it's a nerve difficulty, it was your stroke. Cystitis, underline, star. Do what you got to do with this one. Star and label it and make it different colors. Know what cystitis means. A lot of people don't know what cystitis is. And they don't tell you that you have cystitis, but it only means that you have a bladder infection. Urinary tract infection is what they'll tell you have, a UTI. But more specific, cystitis. If that's what the part, if they've discovered where it came from, cystitis it is. And that is your bladder infected. Bladder swollen, caused by bacteria. What we're going to give you, and they always tell you, urinary tract infection. Now what they're going to give you? Straight. It's a bacteria. What do you give somebody? Antibiotics all day. And also know that cystitis, you will have a burning sensation when urinating. Underline, burning sensation when urinating. That's what makes that important. As opposed to severe pain when you have a kidney stone. And then we give antibiotics, that last sentence. Fallen bladder, another one to star, underline, circle, make different colors and all the above. What's the medical term for a fallen bladder? Cystitis, which is fallen bladder, the other name for it. Sometimes it can be caused by straining, as in childbirth. Actually, your bladder comes through your canal, your vaginal canal. But they call that cystitis. So underline, star that, make it different colors. Urinary retention, we already talked about. And that's it for that one. And that is chapter 10.